Hello, I'm Kerry Grimes, a service support pharmacist for CPNI. Welcome to the training for the Community Pharmacy Emergency Supply Service during a pandemic. In response to the COVID-19 pandemic, the Health and Social Care Board will implement a temporary community pharmacy supply during a pandemic service. The aims of this service is to ensure that patients can access an urgent supply of their regular prescription medicines where they are unable to obtain a prescription. It's also to ensure equity of access to medicines irrespective of the patient's ability to pay. So documentation should be delivered to all pharmacies by Friday the 3rd of April, and this will include the service specification and guidance, the contract to provide the service, and 200 of the new duplicate PV1 forms, and I'll go through those in more detail later. All documentation relating to the service is currently available on the BSO website. The temporary service will commence on Monday the 6th of April, and it's anticipated that this service will be provided by contracted community pharmacies during the pharmacy's opening hours. On Tuesday the 7th of April, there will be an ECHO training session, and details will follow shortly of this. This service will be provided under Regulation 226 of the Human Medicines Regulations 2012. Which enables the emergency sale of prescription-only medicines by a person lawfully conducting a retail pharmacy business if the following conditions A and B are met. Condition A is that the supply is made whilst disease is, or in anticipation of a disease being imminently pandemic and a serious risk or potentially a serious risk to human health. Condition B is that the pharmacist by or under whose supervision the prescription-only medicine is to be sold or supplied is satisfied, that the treatment with prescription-only medicine has on a previous occasion been prescribed by a relevant prescriber for the person to be treated with it, and as to the dose which in the circumstances it would be appropriate for that person to take. It is important to note that the terms of Regulations 224, which is an emergency supply made at the request of prescriber, and 225, emergency supplies made at the request of a patient of the Human Medicines Regulations 2012 still stand, even though Regulation 226 has been brought into force. Therefore, a pharmacist can still make supplies under 224 and 225, but if they do, they are bound by the requirements laid down in those regulations. However, these supplies, namely under 224 and 225, would not be made under the terms of this service, which relates to Regulation 226 only. A contract will be distributed to all pharmacies with the documentations by Friday the 3rd of April. It is not necessary to return a signed contract to the local office in order to provide this service. The contract must be signed by the contractor or responsible pharmacist and retained in your pharmacy. This will act as an assumed contract to enable your pharmacy to provide this service. Although an assumed contract is being issued, contractors are not obliged to offer this service. And should you choose not to provide this service, you must contact your local Health and Social Care Board office by Friday the 3rd of April. For a patient to be eligible for the service, they must be registered either permanently or on a temporary basis with a GP practice in Northern Ireland. The patient must have previously received a supply of the requested medicines via prescription from their own GP practice or a non-medical prescriber. Patients not registered with the GP practice are not eligible for an emergency supply via this service. Patients who are not eligible to access the service should be referred to a GP practice or the out-of-hours medical service. If this is not possible or appropriate, the patient may still be dealt with in the usual manner under HMR Regulations 224 and 225. Pharmacists should use their professional judgment to determine if there is a reason why a supply is not appropriate. For example, if the next supply of repeat medication is not due, the request is for an acute item, or the request is for a medicine that appears to have been previously discontinued. If the previous supply cannot be confirmed, pharmacists may determine they cannot make the supply as they cannot validate the medicine requested. If a patient's GP practice is not operational, they should be referred to the local cluster GP practice or to the out-of-hours medical services. All of the above will have access to the patient's NIECR and can issue a prescription for the patient if appropriate. When providing this service, you must consider eligibility. Confirm that the patient is eligible to use the service, i.e. registered with a GP practice in Northern Ireland. Patient consent. If a patient or patient carer requests this service, then consent will be assumed. Therefore, it is not necessary for the pharmacist to record patient consent. Identification. Where the person requesting the supply is not known to pharmacy staff, steps should be taken to confirm the validity of the request for an emergency supply, and if possible, to check the identification of the requester. Pharmacists may find it helpful to record the name and the contact details of the requester in the patient's PMR. This information may also be recorded on the pharmacy voucher. Privacy notice. Ensure the patient is aware of the way in which their personal information will be processed. Advise the patient or carer that the details of the medicine they have requested via the emergency supply will be shared with their GP practice, the BSO, and if necessary, the board and the Department of Health. It is not necessary for the pharmacy to provide each patient with a copy of the privacy notice, but a copy should be provided to the patient upon request. Establishing need. Obtain information on the medicine and the dose a patient requires. Ensure the patient does require the medicines being requested. Regulation 226 does not require a pharmacist to interview the person requesting an emergency supply. It is recognised that a patient who requires an emergency supply may be adhering to the Public Health Agency's COVID-19 guidance to self-isolate. Therefore, in some situations, it may be a representative of the patient who is requesting an emergency supply. In this situation, pharmacists are asked to use their professional judgment and to consider the best interests of the patient. Where practical, the pharmacist may wish to speak directly to the patient or the patient's carer via telephone. It is not a legal requirement under Regulation 226. However, the pharmacist under whose supervision a POM is to be sold or supplied must be satisfied that the supply is needed. Therefore, a consultation will be required to ascertain certain information. It is envisaged that this consultation will be carried out by a pharmacist or a member of staff identified by the pharmacist with sufficient skills and knowledge to carry out such a consultation. The pharmacist is reminded of the need to keep a social distance of at least 2 meters where possible from the person requesting the supply to prevent droplet spread. Access to the patient's PMR. Where the pharmacy does not have access to the patient's PMR, reasonable attempts must be made to ensure the patient has previously received these medicines via prescription from their GP or non-medical prescriber. For example, an empty packaging with a pharmacy label attached, a patient reorder slip, i.e. the right-hand side of a prescription, and the information received upon discharge, such as a medicine's reminder chart. Supply of medicines. Whilst there's no maximum supply quantity associated with Regulation 226, it would be considered good practice to supply up to a maximum of 30 days treatment, or in the case of insulin, ointments, creams or inhalers, the smallest pack size available. A full cycle of oral contraceptive could be supplied. Under the terms of the Human Medicines Regulation 2012, pharmacists cannot make emergency supplies of Schedule 2, Schedule 3 or Schedule 4 Part 1 controlled drugs, with the exception of phenobarbital or phenobarbital sodium for the treatment of epilepsy. It's worth noting, should the ongoing pandemic necessitate a change to these terms, whereby pharmacists may be given the authority to make an emergency supply of a CD, pharmacists will be notified by the Health and Social Care Board and the Department of Health in advance of any implementation date. Medicines liable to abuse or misuse. Pharmacists should be mindful of persons who may seek to access medicines liable to abuse or misuse via this service. Where a patient currently receives their medicines dispensed in instalments, for example weekly dispensing, then quantities should be supplied in line with the normal quantity supplied via prescription. Medicines not supplied. In some cases, the pharmacist may determine that it is not appropriate to supply some or all of the medicines a patient requests. Successive supplies via emergency supply. There is no restriction to patients receiving further supplies of the repeat medicines via this service. It is recognised that as the pandemic continues, following an initial supply of the medicines via this service, a patient may have to make further requests for emergency supplies of their medicine. By labelling the medicines, a record will be made in the patient's PMR. This record will be considered sufficient to meet the requirements of this service. Some clinical systems may have an emergency supply default. Under the terms of Regulation 226, a record of the supply does not have to be made in the pharmacy's prescription-only medicine register. The pharmacist must complete the new pharmacy voucher, which is a non-carbon required duplicate copy pharmacy voucher. These are distinct from those used to deliver the minor ailment service and the smoking cessation service. These should be delivered to your pharmacy by Friday the 3rd of April. So as described earlier, in some instances it may be advisable to get the patient or the person requesting the emergency supply to sign and record their contact details on the front of the voucher where possible. So where the patient or the patient's care is known to the pharmacist, the patient is not required to sign the pharmacy voucher. If it's a patient representative, e.g. a community volunteer requesting or collecting the emergency supply, they should sign the front of the pharmacy voucher and record their contact details if this is possible. If the patient or the patient's care is not known to the pharmacy staff, and the pharmacy doesn't hold the patient's PMR, the requester should sign the front of the pharmacy voucher and record their contact details where possible. The pharmacist must then fully complete and sign the pharmacy voucher at the time of the consultation, recording the patient's details along with the names and quantities of all the medicines supplied. Pharmacists are not required to write the directions of the medicines supplied on the pharmacy voucher. A record of the GP practice that the patient is registered with should be written on the top left-hand corner of the pharmacy voucher. This will ensure the patient's GP can be notified of the supply. The voucher should then be accurately coded for the medicines and quantities supplied using the relevant codes from the Northern Ireland Codebook. The minor ailment service consultation fee code, the formulary item codes or the urgent fee code or multiple dispensing codes should not be used, and the voucher should then be endorsed emergency supply. The top copy of the pharmacy voucher should be handled in the normal manner and forwarded to the BSO with the pharmacy submission for payment. The bottom copy should be delivered as soon as practically possible to the GP practice to provide details of the medicines supplied. Please note this should not be faxed or emailed or posted to the GP practice. The GP is required to annotate the patient's medical notes to indicate that the patient has received an emergency supply. Initial funding of $1 million has been made available to set up and deliver this service during April 2020. And a tiered payment model based on prescription volume will be used to allocate this funding. And pharmacists will be reimbursed for the medicines supplied using the new pharmacy voucher. Pharmacies will receive a second allocation of 200 PV1s at the end of April, and guidance on how to order future supplies of the new PV1s will accompany the second allocation. So in summary on how to deal with requests for an emergency supply of repeat medicines through this service. Establish who is making the request. The patient may be following the PHA advice to self-isolate. Regulation 226 does not require pharmacists to interview the patient, so you should use your professional judgment and consider the patient's best interests. A telephone conversation with the patient may be required if possible to confirm the request. If necessary or if possible, check the ID of the person making the request if they are unknown to you, whilst maintaining social distancing. Confirm patient eligibility for the service and consent does not need to be recorded. Make patients aware of the privacy notice which you should display. Then establish the need for the medicines requested using the PMR if possible. If not, use other means such as the prescription reorder form or empty packaging with labels attached. It's recommended to supply up to a maximum of 30 days treatment. Controlled drugs Schedule 2, 3, 4, Part 1 CDs cannot be supplied, and you should exercise caution with medicines liable to abuse or misuse. It's good practice to endorse the label emergency supply. The pharmacist may determine that supply of part or all of the patient's medicines is not appropriate. The patient may require successive supplies via this service. When labelling, a record of the medicine supply will be entered in the patient's PMR, and if appropriate, make a record where possible of any medicines not supplied and the reason for this in the PMR. A record in the prescription-only medicine register is not required for supplies made via this service. Endorse the pharmacy voucher emergency supply and complete the patient details and record in the voucher the name of the patient's GP practice. If possible, record the name and contact details of the person requesting the supply on the voucher. Record the names and quantity of the medicines supplied and accurately code the voucher. Then send the top copy to the BSO with a normal submission, and the bottom copy should be delivered to the patient's GP. Before you commence the service, some action points for contractors. Retain in the pharmacy a copy of the contract signed by the contractor or responsible pharmacist as proof of contract. Ensure that all pharmacists involved in the provision of this service have relevant knowledge of the emergency supply provisions of Regulation 226 of the Human Medicines Regulation 2012. Ensure that all pharmacists are competent in the operation of the community pharmacy emergency supply during a pandemic service by reading the service specification and guidance, completing this training, or attending the ECHO training event on Tuesday the 7th of April. Ensure that only the new NCR duplicate copy PV1s are used in the delivery of this service. Ensure that a standard operating procedure is in place to support delivery of this service. And please note that the MPA will be producing an SOP template for their members. The full service specification and guidance for community pharmacists can be found on the BSO's website at the following link. For any queries, please contact either your local Health and Social Care Board office or anybody at the team at CPNI, myself, Kerry Grimes, Mike Mooney, or Catherine Kidd. Thank you for listening.